I am Virginia Despine. I am the interim director for the Student Parent Support Center. We are a center on campus that provides not only childcare for the student parents on campus, also for staff and faculty as well, but we also provide resources for student parents on campus and basically anything child related on campus. So anything that's any kind of resources that student parents could need. We have a free diaper bank, free childcare during finals week. Basically any kind of resources that student parents could need, we try to help them find, and we try to fill the gap for student parents. So sorry, lots of words this morning, but anything that student parents could need, we try to help them meet those needs. So that is what our office does. And this morning we are here helping student parents with mental health issues and hoping to help them with those needs on campus. Again, my name is Virginia Despine, and this morning, if you are more comfortable having your cameras off, then feel free to do that. You also do not need to show your names. So if you're more comfortable with that, that is fine, and that's your choice as well. This morning for our meeting, our moderator will be Dean Osteen, and we are going to, he is from the College of Social Work, and we are going to turn the time over to him to be our moderator this morning.
Thank you, Virginia. Good morning, everyone. Welcome. My name is Philip. I prefer to go by Philip. As I tell people, I've been Philip a lot longer than I've been Dean, so feel free to talk to me that way. It's a privilege to be here this morning to moderate the panel. We have some incredible guests today, and I think you're really going to enjoy and find this useful. I do want to start out by saying that the topic of suicide in particular can be really challenging for people. Nearly all, if not all of us, have been touched by suicide in one way or the other, either personally or professionally, through the media. There's lots of ways that we've experienced this. And so understanding that it can be a really sensitive topic and a really hard topic for people, I want to empower and encourage you to take care of yourself during this discussion. If that means that you need to exit out of the Zoom for a little bit, you are welcome to come back at some point, or not, if that's the right thing for you to do. Please reach out to us through chat if you feel you need additional resources. I think we're really privileged to have Diana here with Safe UT. We have the new suicide prevention hotline, which is 811, if I get that correctly. You're going to tell me I got it wrong, aren't you?
Yes, sir. 988.
988. I do that every time. 988. Thank you, Diana. But the most important thing is we want to be here for you and to make sure that you're taking care of yourself. Again, we are recording this today, so if you would like to have your camera off, or if you would like to change your name on the screen, please feel free to do that. And finally, we have a lot we're going to talk about today, a lot of questions. So we're going to do our best to get through all the questions for the panelists and for those that the audience had submitted in advance. If we don't, please, you can post questions in the chat and we'll make sure we'll get those down. And our panelists have agreed to provide their email addresses, so if you want to follow up with them with additional questions. So now let me take a moment and introduce really an incredible group of people who will be your panelists today, starting with Diana Ballesteros. Diana is the outreach coordinator for Safe UT, and she plays a pivotal role in fostering connections with communities across Utah and raising awareness about the Safe UT program. With a deep-seated passion for mental and emotional wellness, Diana brings over a decade of experience to her role. Her extensive background includes serving as a certified crisis counselor with the Utah Crisis Line, where she provided critical support during high-pressure situations. She has also excelled as a peer support specialist, championing the mental health needs of the Hispanic community through collaborations with organizations such as NAMI Utah and Latino Behavioral Health Services. During the COVID-19 pandemic, she offered vital emotional support through the Utah Strong program at the Utah Department of Health and Human Services. And her commitment to mental health advocacy and community outreach underscores her dedication to improving lives across the state. Next, we have Paige Ibarra. She specializes in supporting children's mental health through play therapy and parts-based approaches at Sandcastle Family Counseling in Riverton. With extensive training in IFS, family play therapy, child-led play therapy, and parenting, she helps families develop stronger connections and emotional understanding during challenging times. She is particularly passionate about empowering parents with the confidence to understand and support their children's emotional and developmental needs, and welcomes additional questions at her personal email. Thank you, Paige. Dr. Aaron Fisher is an associate professor of school psychology and adjunct assistant professor of psychiatry. He serves as the director for the University of Utah Technology and Training Education and Consultation Lab and directs the Utah School Mental Health Collaborative, which partners with numerous school districts across Utah to provide technical assistance, training, and support for educational settings. Also, Dr. Fisher directs the Huntsman Mental Health Institute Home Program's Interdisciplinary Pediatric Feeding Disorders Clinic. Dr. Fisher is a licensed psychologist and a licensed board-certified behavioral analyst who has extensive experience in research and development, data analysis, and support implementation as evidenced by his almost 20 years working to provide mental and behavioral MTSS supports in schools. Welcome, Aaron. And finally, Nata Choi. Pronouns are he, they, and is originally from Bolivia and is half Peruvian and half Korean. Nata currently works at Latino Behavioral Health Services as the Director of Peer Services and is a graduate from the University of Utah with a master's in social work. Nata has been working with the Latinx community for over 5 years and has developed several psychoeducational programs for children and their parents, as well as the school peer support program for school districts around the state of Utah. Welcome, Nata. And as I told our audience, it's an incredible group of people we have today. So let's jump right in. If each of you would take a quick moment and just share a personal story of experience about why you are here today.
Dean Phillip, let me begin. Thank you so much for that introduction. One of the main reasons I'm here is not only has my work with SafeUT helped improve the lives of students, parents, and education throughout the state of Utah, one thing that is really dear and important to me is mental health. As a child who grew up here in Utah, who remembers being in their early teens, mid-teens, and as a young adult, having very little support at that time in the school system with people that understood and were able to provide that extra emotional support in those crisis moments. That is why I spend my time promoting information and sharing the importance of mental health and sources like SafeUT and 988. So thank you.
Thank you. Paige.
Thank you again for that introduction. For me, I think like so many of us here, we've been touched in some way by the topic of suicide. And working with kids, it's something that I unfortunately do see a lot of. And when you sit in a room with a 5-year-old who has some of these thoughts and you really have to sit and hold their emotions for them, that can be heavy. And so I understand what that can be like for parents, and I want to provide parents with any sort of support, any sort of education that I can to help them through this time.
Nata.
Good morning, everyone. I'm here today because although I am a social worker, I'm also a person in long-term recovery. And what that means to me is that I've been diagnosed with depression and anxiety since I was in my teenage years. And so with that, I've had a personal experience with suicidal ideation and self-harm. And I know what it feels to be in that position, in that dark space. And because of that, it has informed my work to be able to help others, specifically children and their parents, to form a stronger relationship and also begin to understand what mental health really is. It's not like a character trait, nor is it a choice, but it's something that we all experience, that we all go through. And one of my main goals is to eliminate the stigma of mental health and be able to help everyone start that conversation.
Thanks, Nathan. Aaron.
Yeah, thanks so much. And I just really appreciate everyone's responses so far. It really resonates with me. I totally agree. Not only like my own personal experience with mental health, family suicide, but also being in this field as a provider really gives some context. And the space that I'm in now, really helping schools to implement really effective systems to prevent mental health issues and suicide, but also to promote resilience. It really came from a community response. And it was everyone here in Utah, like many of the great panelists and all the folks on the call, wanting to make change and wanting to have more folks in our community feel empowered to talk about mental health and to have educators know where to go when their students have mental health issues. And so for me, the reason why I'm here is because the community has overwhelmingly responded that this is important, and that really aligns with my values. And so I'm super excited that I get to play, a small part of this bigger picture of what we're trying to do to help our youth here in Utah.
Thanks, Aaron. So as we dive into some of the questions and issues, I want to encourage the panelists to really have a dialogue amongst yourselves so that it's not simply answering questions that I ask you. I think your collective wisdom and experience and the way you can share that knowledge among each other will be particularly helpful for us today. But we're going to start out thinking about myths, because I think it'll be helpful to recognize it before we get into some of the more information. So I would ask any of you your thoughts about what do you think are common myths that people have about children's mental health?
Go ahead and start if that's okay. One of the biggest things that I think is a myth is that kids should be happy. Kids, they don't have a reason to be sad. They have everything that they need, and almost like it's spoiled for them to have some of these thoughts. And I think a part of that is parents, they work really hard to make sure that their kids live comfortable lives and that they're provided for. So I think that perspective is valid, but it also makes it really hard to be able to empathize with your child. And that's an important part is keeping an open mind and being curious about what your child is going through.
I would also like to add to what Paige said. It's important to begin conversations about mental health, and that doesn't mean starting straight with suicide ideation and conversations like that, but it's even just identifying emotions and being able to start those conversations relatively early. We see that when parents do start those conversations with their kids at an earlier age, they tend to create better connections with their kids. And when the kids do tend to struggle, the kids know that they have a safe space with parents that will be able to help them through the process and through those struggles. So allowing that conversation to begin at home and sharing simple facts of what did your day look like, or what happened, what's going on, let's talk about this, and let's identify those emotions and what's going on. That is really important.
I also would like to jump off of what Paige said. I think, at least in my community and a lot of communities of color, like mental health does not exist. And so when we're talking about children, like children are too young, they're too little, they don't understand, they can't understand, they don't listen, they're not paying attention. You know, children are, just these innocent little things, and they are, and they're also paying attention, and they're sponges, even if they are, a little baby, even in the womb, they are listening. And so I think it's very important to also consider the cultural aspects of beliefs of mental health, and especially in children, like for example, children don't need to be heard, or children need to be really quiet. They don't need to express emotions. They need to stop crying. Um, and that is all like, you know, a big part of like the respect within some cultures, but at the same time, it does limit how much a child can express and really like connect with their parents. And so there, I think there are a lot of cultural factors to also that come into this myth, you could say.
Yeah, I think that's such an important piece. And thinking about the cultural factors and knowing that it's going to be so different across communities, that we're really taking the time to understand like where the barriers are, and also helping to address some of the stigma, some of the demystification process by empowering schools and communities and everyone to kind of be part of this and not just put that burden on parents, or any one group. I think one of the myths that we see in schools is if we ask kids questions about their feelings, that we're going to somehow incept their minds to start thinking all these really intense things. And I think that's not necessarily the case. These kids are struggling already. We are just now finding out. So I think one of the best things that we can do is get upstream, try to be more preventative, and identify kids who are at risk for developing anxiety and depression. And that might be because they don't have a context to speak about these things in other settings. So I'm a big proponent in schools. We look at reading, we look at vision, we look at hearing multiple times to screen for these things, but we don't ask kids how they're feeling multiple times. And that to me is a huge miss, especially in education spaces where kids spend most of their days.
So I think everything you said sort of dovetails in what is a major part of the discussion today around how do you talk to children about these issues. And, you know, one of the things I would like to start with in Diana and, you know, providing that emphasis on early conversations, daily conversations. Why do you think parents may or do, and let me extend beyond parents, caregivers, adults that care about children that are in their lives? There's a wide range of people that are in children's lives. Why do you think they may be hesitant about talking about mental health with their children?
That is a fantastic question. I think it is really important for us to first kind of think how that conversation was started for us. How did someone begin that conversation with you about mental health? And for many of us, this wasn't in the home. This is something that we found out through seeing other people or interacting or dealing with our own struggles and realizing that we were not actually dealing with them, just kind of stuffing them down or coping in ways that were not always healthy. Um, I think it is very important that even if you haven't had the experience before, let's start that conversation. For many parents, if you don't know how to start this conversation, resources like Live On, where they will help you with instructions and guidelines and other resources that can help begin that conversation about mental health with your child. This could also be as simple as when you get home, start by asking, how was your day? How did that make you feel? Let's begin identifying those emotions and let's talk about it. Let's destigmatize emotions from positive and negative emotions. They're all just emotions, and kind of begin that conversation slowly. If anyone is interested, CEFUT also has some conversation starters that I'm willing to send out to anyone as long as they message and email me, and I'm happy to put the email in the chat box. So thank you.
Kind of jumping off of that too, like as a family, most of the time families they talk about movies that they watch, they talk about um, what they did at school that day, but they're not having some of these bigger conversations. And I think that's a really important piece is to be able to do that. You know, if you talk to a kid about suicide and you ask them if they don't know, if they're not feeling suicidal, they'll look at you like you're crazy. They'll have no idea. They'll have no concept of what you're talking about. And so I think that fear of causing suicidal ideation in a kid or causing a mental health struggle in a kid is a valid fear too, and a myth that I hear a lot.
Going off of that, I think like Paige said, like there's this like rhetoric that if we talk about it, it will come through, like, you know, manifesting it. But in reality, shame grows in silence, shame grows in secrecy. And so if we're not talking about it in our families, in our communities, if we're not bringing mental health up in any capacity or form, including like emotions, feelings, just moods, you could say, then we are not allowing that space to occur. But I do want to like validate the parents' perspective because they're scared. They're scared that something worse will happen to their child, or they're already like um, uh, thinking that their child has these suicidal thoughts because of the way they're speaking or the way that they're behaving. And parents, like, the fear of losing their child or something happening to them is so great that sometimes it becomes what's that called? All those words in Spanish are coming up, but like you just kind of like freeze, like you just freeze, and then there's no conversation. We don't talk about it, but we don't ignore it either, and it's just kind of like we need to start having these conversations. And like Diana said, it could just be about school, and then home, and then friends, and then feelings, and then like, are you having thoughts of hurting yourself? And that question, like being direct and being open about that, can really, really save lives.
Yeah, I so appreciate that. And I dropped a few resources in the chat that are just really great, kind of thinking about children across the lifespan, and having content that's developmentally appropriate. Because of course you're going to talk to an adolescent about their feelings in a different way than you're going to talk about, a young elementary age a student. But I think that as we're thinking about how to talk about these things, I think just the thing to underscore is that you have to talk about these things, and it's gonna feel scary if you don't have the skill set yourself. But it doesn't mean you can't learn and feel empowered. And I think the most important thing is if you see your child withdraw, if you see your child change in the way that they've been acting, that's the time to definitely ask them these questions, and to kind of expand off of just questioning, but also empowering that you don't have to be the end all be all resource therapist person to solve all the problems. There's a community model called QPR: question, persuade, refer. It's very common, and all of you could get trained in this. This is readily available in our communities. But it teaches people like parents and educators and friends, peers, right, to know what to say and how to navigate conversations, especially the really scary ones around suicidal ideation. And so just quickly going through it, just so I don't leave you all hanging. Nata already talked about questioning, and this is really like ask the tough questions in a developmentally appropriate way. Build hope, persuade them that their life is worth living, right? And that's really important to build, because hope is the antidote, right? That we try to use to try to change the context. And then to refer. Like I said, you don't have to be the provider, the expert, but we have places in the community that you can bring people. We also have resources in the community that you can call and connect with in moments of crisis. And just knowing that those are all out there, I think really important to feel even slightly less intimidated to approach that conversation, which can feel intimidating.
Yeah, appreciate that. You know, my early work was around training providers to do suicide intervention and prevention. And we constantly found when we said, why do you not want to ask the question, or why don't you ask the question? And across the board, the answer was, because I don't know what I'm going to do if they say yes. That's scary, right? I mean, that's a hard thing. And one of the things, you know, when we work with providers, and I think the same as when we work with other adults in children's lives, is you have to remember that that fear is about you. It's not about the child that you're trying to work with. And no matter what you're experiencing, no matter how scared you might be, it pales into comparison in what they are experiencing right there. So sometimes we have to take our feelings and put them aside so that we can be there for those who need that support in that moment. And I do want to, QPR is such a great training. And one of the things it does is it really helps us understand anybody can engage in this work in someone's life. So I know we're talking about parents, but there are other grandparents, aunts, uncles, siblings. Anyone who plays a role in a child's life has the potential to intervene when a child is struggling. And so I would like to continue to support that message. It's not just parents and children, it's everyone who plays a role in the child's life.
Can I say something else?
Please.
Along with that question, with the questioning part, one of the biggest fears is, what if they say yes? We hope that they will say no, and but what happens if they say yes? What do I say? What do I do? What words should come out of my mouth? And that is where some education is necessary and some training is necessary for us to understand and know what we need to say. And another thing is, if we are not able to ask that question, if we really something inside us just won't allow us to ask that question, find someone that does, find someone that can, because that question needs to be asked. And if the question is affirmative, according to the QPR model, we would talk to this person and then find resources for that person. And so when we're asking that question, we have to be prepared for the rest of the conversation.
One thing I also want to add to that is, for parents who are not comfortable having that conversation by themselves and would like to have this conversation, please note, begin the conversation by talking to your child and asking if you can introduce someone else. This is where resources like SafeUT and 988 become extremely beneficial. SafeUT and 988 have crisis counselors and mental health providers that can provide that emotional support, allowing parents and children to connect and communicate with the crisis counselor, ensuring that if these questions are being answered with, yes, I am feeling suicidal, there is someone that can provide support, allowing the child and the parent to be supported at that time, ensuring that the situation can be dealt at the lowest level of care, ensuring that the child can be de-escalated, and making sure that the parents have any extra resources that are also available in their community.
I would also emphasize, you don't have to be an expert. You don't need a license. You don't need a master's in social work to be able to ask a child a question and to be there and be concerned and to care about them. So let's turn a little bit to situations in which a child might come to you expressing thoughts or feelings about dying by suicide. And there's a couple of specific questions that came from the participants that I'd like to put out there for you. So the first is, how would you encourage communication connection so that a child can come to a caring adult when they're struggling versus hiding it?
I'll jump in first on this one. I think that what you're doing before the moment of crisis is really going to be important. And so building a relationship that is really strong and authentic and allows for safe vulnerability around communicating, that has to be cultivated. And so I think, for anyone who wants to be effective, it's thinking about being able to have open conversations around the less scary things, right? And really being able to scaffold up to that, and having the kids that you're working with and your own children know that you are going to be non-judgmental, because no one wants to be vulnerable and then feel really bad about being vulnerable. It doesn't feel super good. So anything that you can do um, to cultivate that early on, I think really opens a door for comfort for the tougher stuff later on.
It's also important to show kids that we all have emotions. So sometimes as adults, we may also be dealing with struggling situations that can feel overwhelming. As adults, we have to be able to be comfortable coping with situations that are hard, and sometimes being able to ask for help when we need it, knowing where those resources are, and showing our kids that if we're not doing okay, it's also okay for us to ask for help. So it's a good conversation to have as kids are growing up.
What about privacy? Something that children and young adults, depending on age, might value more and more as they start to get older. So the question then that was posed is, how do you approach privacy with the child who is struggling or maybe having suicidal ideation or even behavior? What can you do to be both respectful, supportive, and present? It's not an easy one.
Well, I want to just mention like the other side. If we hear that, or our child says like, I'm thinking about taking my own life, there's like an explosion in our heads. There's literally like a whole stress response that happens of like, what are we going to do? What did I do wrong? And all of these other thoughts and stuff like that. And like Diana mentioned, I think the first step to be able to respond respectfully and to listen is to regulate our own emotions, is to really like just sit there with them and just try and take the deepest breaths you've ever taken in your life and really, really, really listen. Because sometimes they don't need to hear advice, or they don't need to hear you should do this or that. Like what they need is just someone to listen, to validate their pain, their discomfort, and to just be there and hold them. But that sometimes isn't possible when we're literally freaking out ourselves. So it's important to take care of ourselves first.
From there, I would also include that it is important to, as adults, I think this answer will depend a little bit on whether the adult talking to the child is a parent or just a caregiver or another adult in the child's life. If it is a parent, it is important to, like Nata said, to be calm and kind of give the child that space to let those emotions out. Understanding that they are probably going to be freaking out. And that's where resources, again, like SafeUT 988 can come in and provide that support for the adult as well as the child. One more important thing with that is to note that when the child is opening up, we have to also be comfortable with the fact that there may be prolonged periods of silence. That is going to be okay. As your child or as the child is telling you more about what they're feeling, give them that space and allow them to feel like their emotions are valid. That is very, very important. Also, if you are not a parent in this situation, it is very important for you to let the child know what your responsibility in this situation is. If you are a parent's friend or an aunt or an uncle or a counselor, it is very important for you to let the child know that you may be legally required to do certain things, that it is important for you to have that honesty to tell the child, hey, I want to help you. I know that this may seem really bad, and it may seem like I'm trying to do things that are going to be against you, but it's not. I am going to do everything that I can to protect you, and I'm here to talk to you and to help you through this process. Remind the child that they are not alone and that you're there with them.
I could ask a follow-up with that, Diana. If you could just go a little bit more into this idea of what are my responsibilities?
I think that is a really, really good question, and it depends on what your role is as a parent or as the adult in the conversation. As a parent, and I will tell you, I have a stepdaughter who we've had these conversations with her. My partner and I talk to her about this because we know that as she's growing up, kids that she may know may feel suicidal, may feel depressed, may deal with anxiety. I will give you just a quick, brief story. When she was about 7 years old, she started to suffer from anxiety, and I taught her some breathing exercises. And it was funny because one day I picked her up from school and she stopped by and she's like, Mom, my gosh, I just wanted to let you know, my friend, don't want to give any child's name, but my friend, she was really nervous this morning because we had a math test and I didn't know what else to do. And I grabbed her hand and I showed her how to do the breathing exercise just like you taught me. That child right there, and something so simple. She took it as a game and she helped her other friend. That is something that to me that was insane. But the reason I say this is something as little as conversations about breathing, about how to talk about not feeling comfortable about conversations. This is really, really important. So your role as what you need to do will depend on the connection that you have with the child.
Now there's Aaron. Paige, would you like to add to that?
Yeah, thanks. Um that reminded me of an experience that I just had recently, in which one of my clients, who I had no idea who um had any sort of suicide ideation. You know, we had worked together for quite a while. She had never indicated, none of the safety measures indicated that she had anything of concern. And she disclosed that she was having some of those thoughts previously. And in that discussion, I asked, what helped? And she said that coming to therapy and talking about it is what helped her. And so I think we underestimate how much of an impact we have just in the relationship with the child. And so that piece of connection, and communication, those are really important aspects. And we can help kids, even if we don't realize, even if it's not explicit as we would like it to be and hope for it to be.
Yeah. So we've talked a lot about what may be happening at home or in another system, sort of in a public system or family system or something like that. But one of the questions we'd had, and I think this is really important, for those of us who work in the healthcare system, we understand what that continuum looks like. But there was a question about what happens if I can't keep my child safe at home? What are those, like, what comes next, or what does that look like? And there was both questions about, I don't know what to do if I feel like I can't keep my child safe, or I'm really scared by thoughts of like the ER or hospitalization or therapy. So could we talk a little bit about maybe what the continuum of healthcare might look like, and helping adults who have children in their life think about maybe when or how we might want or need to engage others in a healthcare setting, because it sounds scary, I think, to some people.
Let me begin that question by saying, for anyone who is concerned that a family member, a loved one, or anyone that you know may be dealing with suicidal ideation, please note that services like 988, Safe UT, and the Warm Line are available statewide. And specifically 988, this is a resource that is available nationwide. 988 is the National Suicide Prevention Hotline. And as of about 2 or 3 years ago, we narrowed that number down to the 3-digit number, making it easily available for everyone throughout the entire United States. More importantly, the reason I bring up these resources is for individuals who don't know how to keep their kids safe and want that extra support. Calling 988 and using services like Safe UT can help, because crisis counselors can help a parent or a child try to de-escalate a situation, ensuring that the child or parent are using the coping mechanisms that the individual would have used or has normally used in the past and may not be remembering at that moment because of the crisis. It is also important that people are aware that crisis counselors and Safe UT clinicians have the ability to provide resources statewide, ensuring that if anyone needs support in rural areas or needs more local support, we can provide that information through the help of our counselors. Also, for that emotional support and that help immediately, services like 988 and Safe UT are connected with the local mental health authority and groups like the MCOT, sorry, the Mobile Crisis Outreach Team, ensuring that if there is imminent threat of harm, we can provide that support by sending out an MCOT team statewide, depending on the location.
I think too, and I love those resources. It's really awesome to be able to send clients to those resources as needed too. And I think a big piece is also seeking help before we get into crisis mode. As we see some of these concerning behaviors come up for children and for teenagers, being able to seek help not only for them, but for yourself as a parent, and to have that additional layer of support is extremely beneficial.
I really appreciate these resources. One of the other resources that came to mind that wasn't mentioned is the Stabilization Mobile Response, which is an intermountain service. And I see the Stabilization and Mobile Response team as a step kind of below MCOT. It's kind of before you're in crisis, and so it's really a community connection. You can talk with them about what's really needed to help, and of course they can escalate to the Mobile Crisis Outreach Team. The other piece that I think came to mind when thinking about like what can you do to keep your child safe, it's thinking about how you create a safe environment at home. And I think one of the leading cause of death by suicide is firearms. And I think it's incredibly important that you're thinking about what lethal means safety measures you're taking in your own home. And that's not saying not to own a firearm or not to have medication around, but it's saying what are you doing intentionally to have safe storage of those devices, of making sure that if there is a time of crisis, that those items are removed from the home through collaboration with family or friends or people you can trust. And so knowing that safety starts at home, and you can do a lot from a prevention standpoint to reduce the risk. And that won't necessarily mean that the attempts would go down, but that there would be removal of lethal means, and that's really important because that reduces the risk of dying.
I also,
And
can I make another comment with that too? Because I think that that was a very good point. With most people who have suicide attempts, the decision to make the attempt happened less than 15 minutes before. So there's that element of impulse control, being able to emotionally regulate, and that huge piece of being able to make the home as safe as possible for these kids when they get into that space.
to follow that line just a little bit, and as we go through this, we're providing people with lots of information and lots of resources. So this follow-up email is going to be critically important so that people don't have to try to remember everything right now, right? Because that would be really challenging to do. But as we think about particularly reaching out for resources, outside family, friends, others who are close to us personally, can you talk a little bit about confronting stigma when we have to discuss mental health outside of our own families with strangers? Or maybe not even maybe in our own families when we have to talk to those who are close to us.
I think in our Western society, this even excuse me, even in other cultures, as you were previously mentioning, um, that's an extremely important piece. And being able to get in that position where you can talk to kids about it, again, that's a really important thing. Um, and I have some more thoughts about that, but I don't want to take over. So I want to let other people have the chance to answer that, and then we can come back to me if we have time.
Okay. I do want to acknowledge the chat. Not every resource is right for every family in every situation. Okay, I'm going to move to another topic and we'll come back to Paige when you put some of those together. So several people submitted questions around, it's kind of a two-parter. What are some of the things that you see that young adults and children are struggling with? And what can adults, caring adults, what should they be looking for? What does that that need on the behalf of a child look like? So I think we're sort of two things, like what might be kids being experiencing, right, that we want to be aware of, and what might that look like when I'm around them to give me a sense that maybe I need to be looking closer at the situation.
Change over time. So knowing your child and kind of tracking where they're at in developmental stages, noticing where they were at 2 years ago, where they were at a year ago, last month, last week, and really honing into those changes that are taking place. Um, and then, of course, isolating from friends and not finding the joy in the play that they used to, especially with young children. Their world is play. And if they're not working through these difficult things that life inevitably brings through play, then they're not able to work through them in their life.
One thing I will also say is we're seeing a lot of kids dealing with stress and anxiety that sometimes seems higher than it was before. Especially in the last few years, we are noticing that kids are acting out in ways that we haven't seen. It is important that as adults, we kind of going back to some of the conversations earlier about taking care of ourselves as adults, it's really important that we show kids what good coping mechanisms are because they are also kind of adapting our own coping mechanisms and making them their own. So it is very important for us to know how to cope with things properly and to know when to ask for help.
I think that there's also an issue of kids just not trusting adults or not having trusting adults to talk to. Um, a lot of my experiences with youth have been that they've been telling me like, you're the only one, you're the only person that I talk to about this, or I don't think I can trust anyone else to talk about this. Um, and I think we need to be um, better adults. I think we need to create that space for children to trust us, to come to us, to talk to us. I had an experience at the high school that I work with where, this kid who was straight A student, in a student body officer, he came up to me one day and just asked me if we could talk, and I was just hanging out. Turns out he was going through a really hard time, and I was so surprised that he reached out, that he asked to talk to me. And I believe it was because I was present in the school and I was someone that they felt like they could trust, someone that they have seen their peers work with. And so, yeah, I think it's important to create that space, to be that person, and to allow these conversations to happen without any judgment or disrespect.
What should parents, caregivers, family, neighbors, caregivers, what should they be looking for if they have concerns? Aaron, I know you touched on it a little bit about like isolation and things like that, but what might be some behaviors or thoughts or things that young people might say that should be particularly pertinent when we want to think maybe this child is struggling?
Yeah, it's such an important question. And not all children will be super explicit and name all the things. I think you'll have a range. You may have some kids who are more withdrawn and isolated. You'll have some kids will start acting out. You might also hear things like them wanting to give away their things or not care about their things, right? Or having sort of disinterest in things that had used to bring them joy. And so I think just being able to be aware of those things in the context of other behaviors is really helpful. But I think to really underscore it's that change. It's this kind of difference in how they typically are. And then just also being aware of just how impulsive your child is, because that's going to be your biggest predictor of death by suicide. Because when the ideation and the action happen, it's a very kind of quick window, and so just kind of knowing your own kid and just kind of being tuned in, so that you're kind of more aware if you have a kid, and most adolescents are, right, who are a bit more impulsive, just making sure that you have strategies to help give pause and help to, deal with some of those things like we talked about through just healthy, effective coping.
So they'll use words like, I wish I could just sleep forever, or I could go to sleep and not wake up. So if you hear comments like that, even though it's not explicit, that can be their way of communicating. And also because I'm a play therapist, focusing on their play and noticing how they're playing with younger children is, are they having kids kind of have this theme. I see it a lot where um, they'll have big fights and then between figurines and one of them will die. Um, but in most cases, they'll be resurrected or there'll be this fight between good and evil. The death isn't necessarily permanent or focused on. But noticing if your kid is playing in a way that the person dies and there's no hope. There's this sense of heaviness, there's this sense of helplessness, and that character won't be brought back to life. That character will be dead forever. So kind of noticing those themes of death within their play because they might not have the vocabulary. And for kids, their vocabulary is toys, it's play. So really honing in on that could be helpful.
All right, jumping back and forth with chats. Let's talk a little bit about strength and resiliency. And particularly, one of the questions we've gotten is, I don't know what to phrase this. What, I don't want to say that. I think part of it started out as sort of how do we develop and support resiliency in children, particularly who may be experiencing lots of challenges, not just mental health challenges, but a lot of challenges. What are some of the ways that we as caring adults can do that and help children develop that sense of resiliency, and have some sense of their own agency, which they can do at a very young age?
I think for a lot of communities of color, our community is our strength, and it is our resiliency, our family, our close connections are the people that will motivate us to stay alive. I think I've made a lot of safety plans with a lot of kids, and a big factor of why they want to keep living is because of their mom, or because grandma's going to be really, really sad, or she's going to get sick if she finds out. And so it's very important to involve the family in the treatment, you could say, because yeah, they probably, and maybe addressing a little bit about what's going on in the chat, they probably won't talk to you about it. They probably won't accept help from you, but maybe they'll accept help from grandma, or maybe they'll accept help from the uncle or the aunt or a cousin. And so we, it takes a village to raise a child, and I think anyone that's around that child can participate in building that resiliency within that kid. I think one of the biggest protective factors for children is having a trusted adult. So it doesn't have to be the parents. For me, it was never my parents, but it was a teacher. It was my counselor. It was my Boy Scouts leader. Those were my trusted adults.
I think that this conversation of resiliency starts even before a lot of this comes up. And helping them see as they're dealing with some really difficult emotions, as children do, helping them sit with that emotion, helping them see, I can get through this emotion and I can get through to see a better day or a better time. I think that would be, for me, the biggest thing.
We have some challenging questions in the chat that I want to propose to you. And I'm gonna read this one verbatim, if you don't mind. And it says, I would like to understand what causes such young children to think about suicide. As mentioned, children as young as 3, 4, 5. Do they really understand what gives them these ideas? And this particular person was asking, as a foster parent, I do have some sense and understanding trauma. But maybe many of us don't have that level of understanding. So I think it's a really important and emotionally and hard thing to think about is how could a child that young have a concept of not wanting to be alive?
It is a really difficult thing to think about. And I think that's maybe even one of the reasons as a society that we don't talk about it, is because it's really hard to talk and think about these things. With children that young, I mean, we have to consider also the biological and genetic factors. And also knowing that that emotional regulation that they're still developing, it's not going to be at the same pace that we're at. And for them, it's being able to just get through it one moment at a time because they have no concept of time, right? So being able to understand that their world is different than how you perceive the world. And yeah, trauma is a big indicator of this. I think it's the statistics are really high with trauma. And a lot of times if they've experienced one trauma, they've experienced multiple traumas. And to not be able to process what they consider to be a trauma can be extremely difficult. And that's important, that language of what they perceive to be a trauma. Because sometimes as adults, we can look at it and be like, oh, that's not that bad. But for them and their world, it's huge and they don't know how to overcome that. They don't know how to do it. And there's that sense of helplessness. So it does occur in kids that young. And I think that that's a really good place to recognize that that's happening, and to be able to support them at that young age and have some of the difficult conversations in a developmentally appropriate way.
Yeah, I so appreciate that, Paige. And just remember that kids, you know, when you're thinking, do they really understand? I mean, I don't know if that's even really important to try to discern. I think what's important is that they are communicating a call for help in the best way that they can with whatever skills they have in that moment. And, you know, all that we can do is try to support them, and try to scaffold some skills maybe for the future, and to keep them safe in that moment. So, um, I think, you know, we always want to try to say, well, is this really an issue or not? And, you know, it's an issue. If someone's communicating that they're hurting, it's an issue. And you take it at face value and you validate them. And maybe kids don't understand the permanency of their actions when they're 3 and 5. And so you know, yes, they may not get that when they say, I want to die, that really means something. But that doesn't mean you don't have to address it and treat it and be developmentally appropriate in how you do that.
Yeah. I love this next question. So one of our attendees is here with her 12-year-old daughter, who is listening to this. And her daughter's question was, so her daughter's part of a Hope Squad at her school, which I think are amazing. But the question is around, like, is it developmentally appropriate, or when is it developmentally appropriate for young adults to provide peer support in this way?
this is such a good question. And maybe other folks have better answers who like Nata, who does this work more regularly. But peers are like our secret weapon, right? If they get it, if they get how to navigate these situations, they feel comfortable with how to navigate these situations, these are going to be the people who our children are most comfortable talking to about all their things. But again, it's not positioning our peers to do this without being empowered and without having support themselves. So, for me, I'm always thinking middle school is really the time that the kids tend to really, really, really start needing us on these really deep emotional ways because of all the relational issues that are happening. And so, I mean, I think it's hopefully you're scaffolding this empowerment to the point where when you start to go to secondary settings, you can start to be a peer support. And maybe you've gone to your own therapy. And so you can normalize that, right? And say, hey, I've been going to therapy since I was in fourth grade. I think those things can be really powerful. And so I resist to say a specific age, but I do think that it's really based on how ready your child might be. And that might be the beginning of them being a mental health provider after they graduate. So, as a trainer myself, I'm like, foster that, please. We need all the help we can get.
For those who don't know what peer support is um, like a peer-to-peer sort of support. And what I mean by peer is someone who is literally on the same level, same experience, and has that like shared lived experience of either mental health or substance use so that they can connect. And for a lot of youth peer support, it has to do with the age as well. Because, as an older person, I don't understand not even the language of some of our youth. But because they are part of the generation, because they're part of the school, like they know and understand, and so they can connect in that way. And we've seen through a lot of research and through a lot of my own experience that when we connect through our lived experiences, our relationship is formed, a relationship of trust, of where we can start talking about these really, really real, important things. And the Hope Squad is a wonderful, wonderful program that provides suicide prevention trainings and a lot of like suicide prevention or suicide awareness in the schools. And it's a wonderful program that really starts to help people have that conversation. A big part of the peer support at schools is to like reach out to kids, to reach out to other people, to let them know that we can talk about it. We can talk about mental health. I'm going to leave a link in the chat of an agency called Youth Move National, and it's a youth peer support organization that focuses on training and also education around youth peer support. And I would encourage everyone to look at it and see how else we can support our young people to support themselves.
I also want to chime in. Just background information. I actually am a marketing major. I did not start down this field until later on. I began in social work because of my own mental health issues. As a teenager, I didn't feel like anyone had the ability to understand what I was dealing with. As time went on, I found mentors with organizations like NAMI Utah and Latino Behavioral. I actually began my process as a peer support specialist. And it wasn't until the last few years that I realized how important that really is. My job now is to talk to students and share the information about resources like SafeUT and 988. But one thing that I did not realize was how big of an impact my own story would have in connecting with students. I am a survivor of suicide. I am an individual who has suffered from substance use and other mental health issues. And at this point, I am willing to share my story with other people because there is growth, because there is more, and because that shows that there is hope and light at the end of what we see to be a tunnel. It is very important that we don't specifically give it an age of when kids need to start including peer support into it, but just know that, like Erin said, it is when people are feeling ready. When you get to a point in your recovery, and for anyone does know any peer supports or has worked in the peer support community, it is very important to know that it is good for you to be able to help others, but it's also important to show others how to take care of yourself by taking care of you first. So that is really, really important. And reminding people, self-care is important. Self-care is something that is necessary, and it looks different for all of us. So it is important to have those conversations and to talk about it.
Thanks. Another question that came up and was endorsed by a few other people, and to acknowledge that there are people with us today who are really struggling with things that are going on with the young people in their lives, and really wanting to do something about that, and in some ways feeling stuck. So one of the questions is around, I have a child in my life who is at risk, maybe has even engaged in some behavior, and they're really reticent to go for help. And I'm not sure, as a parent or a giver or a caring adult, on how to approach that.
It depends a lot on the age of the child. But a big part of getting help can be giving them some power and control with that. So, explaining different types of therapy and what they might want to participate in, letting them be involved in the process of choosing a therapist as, the first line of defense, as well as all of these other resources that have been provided. Just giving them a piece of that. So their life already feels very out of control. So as much as they can do to feel some of that.
Yeah, and I think just expanding off of that, just really trying to lean into exploring the ambivalence of not wanting to go to therapy, or the resistance of going to therapy, and trying to understand where that barrier is coming from. Is that like a stigma, like if someone finds out, they're going to judge me this way? Is this going to impact my ability to do something? I think really trying to understand that context can be really helpful, because then at least how you could start to try to address that. And you may not solve that problem right away, but at least if you know it's stigma, then you can say, okay, well, I need to do some education around mental health and the benefits, or maybe thinking about how my community can lean into saying more of those stories that we've had and like our own personal experience. So yeah, it can't hurt to ask more questions, and just try to seek to understand some more of what's going on.
Well, I think go to what Erin said. If you have an experience of mental health, if you yourself have experienced some sort of depression, anxiety, whatever, like, we need to start normalizing it within our homes and saying like, hey, like, I went through something similar. I I I was having a hard time when I was a kid, and this is what happened, and this is what I did to overcome it. It just, tells the kid that you're human, number one, and number two, that like you also had some of a similar experience and you could make it through. And if my mom or my dad could do it, then maybe I could too.
It's a way to validate emotions, and it's a way to also allow kids to remind each other and remind ourselves that we're human, that we feel things that can be overwhelming, and that there can be things that that can be very challenging and can cause us to struggle, but that with enough time and coping in the way that we approach the situation, there is a light at the end and that we can get through those very tough situations. It's important to, like Nata said, normalize those moments and remind people that they're not alone. I once again will say, some of our kids will say, hey, I'm not feeling well. Can I get 10 minutes to just get some time for myself? And starting those conversations at home, making sure that you communicate with your kids, your partners, your loved ones, what you need when you're not feeling well.
Yeah, and I think there's some important points there about, as caring adults, we're not alone. As children and youth who experience these feelings in the situations, we're not alone. And I think it's important too for, the caring adults here to think you don't have to do it by yourself, right? You don't have to judge yourself on your ability to fix it or not fix it. Your care and concern and love for this child in your life and your willingness to find the help they need, I think, can go a long way. And I appreciate what Nata said earlier. I think it's a good question to say, if you can't talk to me, who can you talk to? Right? And try to find a caring adult. And, research will tell us that one of the number one protective factors for a child is to have a caring adult in their life who will be there for them. As we sort of get to the end, I'd like to invite each of our panelists, if you have sort of a last thought from the conversation or something that we didn't talk that you would like to share with the others here.
There's so much. There's a lot to talk about around this topic. But what I have been reminded of throughout this whole panel is, and I forgive me because I'm not sure who said this quote at the moment. So if anybody knows, please feel free to chime in. But maybe it was Rogers, but it says that anything that's human is mentionable, and anything that's mentionable is human. And I think a big piece of this is that we're all human, and accepting that part, being self-compassionate and being able to recognize within yourself your strengths and within your children and doing your best. There's a lot of support, as you've heard today, and you're not alone.
Thanks.
Okay. I just want to recognize all the parents that are here and the effort that y'all put in to come here and to listen and to inform yourselves and to ask questions. Like, I wish everyone would do that. I wish everyone would, reach out and participate in these events and find out more for themselves, because we can't do it alone. Like, one parent cannot hold the information of the whole world. We need to learn, we need to grow, we need to understand that sometimes the way that we were parented is not the way that we need to parent our kids. And we have different ways to practice and teach our kids how to survive in this ever-changing world. And so I want to congratulate all the parents who are here. Thank you so much for being here, for doing this for your children and for yourselves as well. And I hope that whatever we said landed, and that if y'all had any questions whatsoever, please, at least for me, like, please reach out. I am more than happy to have a conversation over the phone or over email.
I want to echo Nata's thank you to everyone for coming. It is so important for us to remember that it literally does take a village to raise a child. And here we're taking those steps. We are ensuring that we're promoting more information to help our kiddos, and not just our kiddos, but also the adults in their lives. One really important thing that I want to make sure everyone is aware of before we end today is for any parent that is on this call who has questions, who is interested to know more information, please don't hesitate to reach out to SafeUT. SafeUT is an emotional support app that is available 24 hours a day, 365 days of the year. It allows parents, students, as well as educators the ability to connect with licensed mental health providers who are here to provide the service, ensuring that students, parents, and educators have that emotional support completely free 24 hours a day. This could be if you're feeling stressed because of something that's going on in a school situation, if there are other things in your life that are causing you struggles and you need someone to talk to. And one big aspect about the SafeUT app that I do not want anyone to forget, if there is ever a concern of school safety or the safety of a child, please don't forget that SafeUT is also a way of submitting confidential information, ensuring that our kids are safe both in school and away from school. If you are ever concerned, please don't forget to provide that information through the SafeUT app and let us know which school this information is going to. This app is confidential, allowing individuals to provide that support for themselves and anyone in those educational communities. Thank you so, so much. And don't forget, we're not alone. We're all here together, and thank you for coming.
Thanks to all the co-panelists. I'll just wrap up quickly by saying thank you to the organizers for holding this space so that we can talk about this really important topic. And if anyone's following, the Surgeon General had recently said that parents are experiencing significantly more stress than other adults. And for all the parents here, you're like, no surprise. So just know that it is tough right now and that you are experiencing stressful experiences just because you are a parent. But please continue to talk about these topics, especially with those who are closest to you. That's how we're going to really make change in our communities, is by talking honestly with those who we can be vulnerable with. So please be in touch. Thanks everyone for being here.
Yeah, so I'd like to just say on behalf of the panelists, thank you so much for being here. Thank you to our panelists for your incredible insights and support. Thank you to the Student Parent Center for supporting this, for the students who organized and put this together. And again, I would just like to echo the panelists, how grateful we are for those adults who took time out of their day to come here and learn more about how to support the children in their lives that they care so very much about. So thank you to each and everyone, and thank you to the organizers for my opportunity to be a part of this as well. And I hope everyone has a safe weekend.
Thank you.
Thank you. We enjoy it.
Thank you so much. This was amazing.